Have you ever wondered why you're feeling unexpectedly tired, or why you seem to be gaining weight without any significant changes in your diet or exercise routine? Could it be hypothyroidism? Hypothyroidism, a condition where the thyroid gland does not produce enough thyroid hormone, is a real concern for many. Imagine your body as a car, and the thyroid hormone as the fuel that keeps it running smoothly. Now, what happens when there's not enough fuel? The car starts to slow down. This is precisely what happens in our bodies when we have hypothyroidism. The metabolism slows down and the energy levels drop. In recent years, this condition has been on the rise in the United States, with an estimated 11.4% of the population affected in 2019. The symptoms of hypothyroidism can be quite diverse, ranging from fatigue and weight gain to depression and memory problems. However, they all generally reflect a slowing down of the body's metabolism, like a car running low on fuel. Now, you might be wondering, why is it so important to catch this condition early? Well, let me introduce you to a term, myxedema coma. As ominous as it sounds, it's a severe life-threatening complication that can occur if hypothyroidism is left untreated. It's characterized by profound weakness, hypothermia, and even loss of consciousness. Early detection of hypothyroidism is crucial to prevent complications like this. So how do we detect hypothyroidism early? It's through blood tests that measure thyroid-stimulating hormone levels in the body. A high level of this hormone may indicate low thyroid function and thus the presence of hypothyroidism. Now that we've scratched the surface of hypothyroidism, let's delve deeper into its causes. What exactly triggers this condition known as hypothyroidism? This is a question that has been asked by many, and today we will delve into the underlying causes of this intricate condition. First on the list is autoimmune thyroiditis, also known as Hashimoto's thyroiditis. This is a condition where the body's immune system mistakenly attacks the thyroid gland, leading to inflammation and reduced production of thyroid hormones. It's one of the most common causes of hypothyroidism, so it's a significant player in our exploration. Next, we have certain medications that can interfere with the thyroid's ability to produce hormones. These include lithium, used to treat psychiatric disorders, and amiodarone, used for certain heart conditions. It's important to note that a person should never stop taking prescribed medications without consulting their healthcare provider, even if they suspect it might be affecting their thyroid. Radiation therapy can also lead to hypothyroidism. This is often the case for individuals who've undergone radiation treatment for cancers in the neck or head region. The radiation can damage the thyroid gland, resulting in decreased hormone production. Surgical removal of all or part of the thyroid gland is another cause. This is sometimes necessary in cases of thyroid cancer or other thyroid diseases. After the surgery, the body may struggle to produce enough thyroid hormone, leading to hypothyroidism. Now, let's talk about iodine. This mineral is critical for the production of thyroid hormones. However, both too much and too little iodine can lead to hypothyroidism. It's a delicate balance. Lastly, we have pituitary gland dysfunction. The pituitary gland, located in the brain, controls the thyroid by producing thyroid-stimulating hormone, or TSH. If the pituitary gland isn't functioning properly, it might not produce enough TSH, resulting in decreased thyroid hormone production. Certainly, the causes of hypothyroidism are far from simple. It's a condition influenced by a multitude of factors, from our own immune system to the medications we take, the treatments we undergo, the nutrients we consume, and even the function of our brain. As we can see, the causes of hypothyroidism are varied, making it a complex condition to understand. So, who are at a higher risk of developing hypothyroidism? Let's dive into that question. First and foremost, gender plays a significant role. Women are more likely to develop hypothyroidism than men. In fact, the prevalence of hypothyroidism is higher in women, especially those who are middle-aged or older. Age, as just hinted, is another significant risk factor. As we grow older, the likelihood of developing hypothyroidism increases. This is due to various age-related changes in the body, including a decrease in thyroid function. Next, we have family history. If you have a family member, especially a first-degree relative like a parent or sibling with hypothyroidism, your risk of developing the condition is higher. Genetics can indeed be a tricky hand to play with, but it's not just about the genes you inherit, it's also about the medical conditions you might have. Certain medical conditions can increase your risk of hypothyroidism. These include autoimmune diseases such as Hashimoto's thyroiditis, type 1 diabetes, and rheumatoid arthritis. Moreover, if you've had thyroid surgery or received radiation therapy to your neck or upper chest, you're at a higher risk of hypothyroidism. Certain medications can also interfere with thyroid hormone production and lead to hypothyroidism. Lastly, an imbalance in iodine, a mineral your thyroid gland needs to produce thyroid hormones, can also be a risk factor. Too much or too little can lead to problems with thyroid function. So, in essence, while anyone can develop hypothyroidism, you're at a higher risk if you're a woman, older, have a family history of the condition, have certain medical conditions, or have had certain treatments or medications. Awareness of these risk factors can aid in early detection and management of hypothyroidism. Knowledge, after all, is power, and in this case it could be the key to a healthier and more balanced life. How does one confirm a suspicion of hypothyroidism, and what can be done to manage it? When it comes to diagnosing hypothyroidism, the key lies in our blood. Medical professionals typically conduct blood tests to ascertain the condition of the thyroid gland. The thyroid-stimulating hormone, or TSH in particular, is a crucial marker. High levels of TSH in your blood can be indicative of low thyroid function, a condition also known as hypothyroidism. But why is TSH so important? Well, TSH is produced by the pituitary gland, and it plays a vital role in regulating the production of thyroid hormones. When the thyroid gland isn't producing enough hormones, the pituitary gland compensates by releasing more TSH. Therefore, elevated TSH levels could signal that your body is struggling to maintain an optimal balance of these essential hormones. However, diagnosing hypothyroidism is just the first step. Once you've been diagnosed, what's next? The answer lies in hormone replacement therapy. The most common treatment for hypothyroidism involves taking a medication called levothyroxine. This medication essentially replaces the hormones your thyroid gland isn't producing enough of, helping to return your body's hormone levels to normal. Now, it's important to remember that everyone's body responds differently to medication, and the optimal dosage can vary from person to person. This is why regular monitoring is crucial. Your doctor will likely start you on a low dose of levothyroxine and gradually increase it based on your body's response. This way, they can ensure your dosage is just right, not too high or too low. Adjustments may be necessary from time to time, depending on various factors like your weight, age, and overall health. Regular blood tests will help your doctor monitor your progress and make these necessary adjustments. While hypothyroidism is a lifelong condition, with proper diagnosis and treatment, it can be effectively managed. This means that even though hypothyroidism may be a constant companion, it doesn't have to control your life. With the right care and treatment, you can lead a normal, healthy life just like anyone else. Did you know hypothyroidism rarely occurs in isolation? That's right. This condition often keeps company. It frequently coexists with other health conditions, making the journey of understanding and managing this ailment a bit more complex. Let's delve a little deeper into this aspect. Hypothyroidism is commonly associated with autoimmune diseases. This is because the same immune system dysfunction that can lead to hypothyroidism can also result in other autoimmune conditions. It's as if the body's defense system gets a bit too enthusiastic and starts attacking not just harmful invaders, but also its own cells, including the thyroid gland. Certain medications can also contribute to hypothyroidism. These drugs may not directly cause the condition, but they can affect the thyroid gland's ability to produce the necessary hormones, tipping the delicate balance of your body's metabolism. An imbalance of iodine, a key element in the production of thyroid hormones, can also play a part. Too much or too little iodine in your diet can disrupt the thyroid's normal function. Also, a dysfunction of the pituitary gland, which is responsible for controlling the thyroid, can lead to hypothyroidism. The co-occurrence of these conditions with hypothyroidism underscores the importance of comprehensive health monitoring. If you've been diagnosed with hypothyroidism, it's essential to keep an eye out for symptoms that might suggest the presence of other related health issues. Be proactive in informing your healthcare provider about any new or worsening symptoms so they can adjust your treatment plan as needed. Remember, your body is an intricate network and everything is connected. A problem in one area can have a ripple effect, impacting other parts of your body. So when dealing with hypothyroidism, it's not just about managing the single condition, it's about taking a holistic view of your health, being aware of the potential for co-occurring conditions, and addressing them promptly. Hypothyroidism may not be a standalone condition, making it all the more crucial to stay vigilant about our health. Our journey into the realm of hypothyroidism has been enlightening, hasn't it? We've dug deep into the causes, symptoms, and treatments of this condition, but there's a crucial point we must revisit. There is currently no known prevention for hypothyroidism. This might sound disheartening, but it bolsters the significance of early detection and proactive management of the condition. Understanding your body, recognizing when things seem off and not shying away from medical consultations, these are paramount steps. The journey with hypothyroidism is not an easy one. It's a path of regular monitoring, medication adjustments, and constant vigilance. But remember, it's a journey you never have to walk alone. Medical professionals, family, friends, and even online communities are there to support you every step of the way. If you suspect that you may have hypothyroidism, don't hesitate. Seek medical advice. Knowledge and action are your best defenses against this condition. Stay informed, stay healthy.